All right, the first polling question asks, what percentage of adults in the criminal justice system have a serious mental illness? All right, our next question. What percentage of youth in the juvenile justice system have a mental health condition? How do you change a police officer's perspective on disability? How long is CIT training? All right, and this is our last question. True or false? CIT stands for Crisis Intervention Training. All right, thank you to everyone that was able to participate in our polls. And don't worry, if you didn't get to participate here, the same questions will appear in the post-webinar survey, so you'll have a second chance. And you can also, if you learned something new during the webinar, change your answer in that post-webinar survey. All right, I am going to pass the presentation over to Laura Usher. Hi, Laura. Can you make sure that microphone to the right of your name is not red? There we go. Now we hear you.
Great. Sorry about the delay with that. And I'm going to apologize right as I start. I have a little bit of a cold, so I might sound like a very hoarse or a baritone. It's unusual for me. So I apologize. I don't too much on you guys. So thank you for the introductions and the polling questions. I hope you guys found those interesting. My name is Laura Usher. I'm the CIT Program Manager at the National Office of NAMI, the National Alliance on Mental Illness. And my job at NAMI is to assist local affiliate organizations and state organizations to start and crisis intervention programs in their local communities. You'll notice I say crisis intervention teams, crisis intervention training, so that might answer some of the questions, pretty long.
Hey, Laura, I'm going to stop you for just a second. We're having a little bit of trouble hearing you. Would it be doable for you to call in on the phone?
Sure.
Yes, if you go to the communicate button at the top and do audio conference, I think you can switch your audio.
Oh, you know, can I? Okay. Give me just a second.
Thanks for your patience, everyone. We just want to make sure you can hear all the great information Laura has to share. And a couple of you had told us in the chat box that it was pretty bad on your end too. So we'll get that fixed up. All right, Laura, actually, if you can go in on your computer and hit the communicate button and switch your audio. It's communicate audio conference.
Okay, can you still hear me on the computer?
Yes.
Okay, hold on.
We can't hear you now. So can you dial in with your phone from here? There we go.
Sorry about that, everyone. I had to run around my house looking for my phone, so I apologize for that. So just to sort of reboot from where we were at the beginning, my name is Laura Usher, and I am the Crisis Intervention Team Program Manager at the National Office of NAMI, which is the National Alliance on Mental Illness. And my job at NAMI is to assist our NAMI state organizations and affiliate organizations around the country in starting and sustaining crisis intervention team programs in partnership with their local police departments. So I'm going to talk today a little bit about the experience that NAMI affiliates have had working with our local police departments and how that might provide some lessons learned for the intellectual and developmental disability community. I know that some of these experiences won't translate exactly, and I know that the training content will be quite different, but I wanted to talk a little bit about what we've learned in how to partner with police and how to work with them, which I think has been really helpful. So I'm going to start at first just talking about the criminal justice system and why it's so important for us to pardon me, I said earlier, I have a little bit of a frog in my throat, so I apologize if I sound a little croaky. So I'm going to first talk about why we're even concerned about people with mental illness in the justice system to begin with, and why CIT programs emerged. So the first thing to know is that our mental health system is extremely underfunded and fragmented and difficult to navigate. So often people don't receive any treatment until they are in a crisis situation. And then when that happens, they don't know exactly who to call or what to do. So, and many communities have a really acute lack of crisis mental health services. So often individuals and families wind up calling the police because they know that the police can provide immediate assistance, but they don't always know what kind of assistance they're going to get. So most law enforcement officers aren't trained to deal with mental health crisis situations, and many don't know how to link a person in crisis with mental health services. So we wind up with a really unfortunate situation where there are unnecessary injuries, unnecessary arrests of people with serious mental illness, and on an occasion, unfortunately too frequently, deaths of individuals and of officers. So really an unpleasant and tragic situation in a lot of cases, and something that we've been trying to address. I want to show you a picture just to illustrate this point of the nation's largest mental health treatment facility. It's the Twin Towers Jail in Los Angeles, California, and it's closely followed by Cook County Jail in Chicago and Rikers Island in New York as the nation's largest treatment facilities for people with mental illness. And if you look at any county around the country, it's likely to be the county jail that is the biggest mental health treatment facility, unfortunately. About 20% of adults in jails and prisons in this country have a serious mental illness, which is about 500,000 people on any given day because a lot of people cycle in and out of jails. About 70% of youth in the justice system and the juvenile justice system have a mental health condition. So the numbers are even higher for youth, and it suggests that young people's lives are getting off track really early on, you know, not being in school, not being stable with their families, and having a real hard time with the justice system. So these are some really alarming figures that we've been trying to address. And then we also know that most people with mental illness who are in jails and prisons are either charged with or convicted of nonviolent offenses. So there are certainly some serious crimes that, you know, we have to respond to appropriately, but the majority are not violent offenses. So these are not necessarily people that need to be in the correctional system. And finally, something that's important to note is that about 72% of the people with mental illness in jail and prison have a co-occurring substance abuse issue. So these are folks that need a lot of services and a lot of support, and often don't get that kind of support that they need. So I'm going to talk a little bit about how this scenario led to the creation of the Crisis Intervention Team program. And unfortunately, this broken mental health system has been a challenge for NAMI families for decades. It's not something that's new. So the CIT program started in Memphis in 1988. And it was really the result of a sustained advocacy effort on the part of members of NAMI Memphis, who were both mothers of sons with schizophrenia. And they had both had sort of unpleasant and negative interactions with the police, and they thought there had to be a better way. But their initial efforts to reach out to the police and to the city council were not particularly successful. They were kind of brushed off and, you know, we'll think about it or study it or maybe we'll talk about it later. But the issue sort of came to a head in 1987 when a young man named Joseph Robinson was shot and killed in an encounter with police in Memphis. And Mr. Robinson was African American, and at that time the police chief and most of the officers in the department were white, and there was a huge outcry in the community about the injustice of this situation, and there was calls for the resignation of the police chief. It was very tense, and and the citizens were very upset. And the members of NAMI Memphis at this time, you know, they saw this, unfortunately, as an opportunity, because we don't want there to be an opportunity from tragedy, but they went to the police chief and they said, you know, we want to work with you to prevent this kind of situation from happening again. So we would like to help develop training that will help you better respond to people with mental illness in crisis. And that sort of approach of reaching out as a partner and providing assistance resonated with the police chief and with the mayor, and that's what started the first CIT program. So I'm going to talk a little bit about how the program works, just to give you some of the specifics, and then I'll talk a little bit about some of the lessons that we've learned from implementing the program in communities around the country. So the first thing that's really important to know about CIT is that it's a crisis intervention team, and the team refers to the community team. That team is a group of partner organizations that include law enforcement, mental health provider agencies, and local mental health advocates. Usually they're local NAMI affiliates. So what CIT does is get all these people together and get them talking to each other, and it's often the very first time that these advocates have, that these advocates have talked to each other, and that these professionals have talked to each other and tried to coordinate and problem solve together. Usually they don't talk to each other, and that creates a huge problem when law enforcement are the de facto first responders to mental health crisis, which is the case today in most communities. So that's the first thing that CIT does, is bring these players together. And then it gets them to think about how do they plan and coordinate a better system, and what kind of policies and procedures need to be changed. How do they, you know, what would be a better way to do things? And then in Memphis and around the country, they found that one of the keys is having some really good skill building training for police officers in responding to crisis calls. So the CIT training includes some of the basic signs and symptoms of mental illness, some real face-to-face interaction with people living with mental illness, usually people who have been in crisis in the past but are doing well now, and that's something that's really important about the training, that it provides that kind of perspective that mental illness is a cyclical disease, that there are times when people are doing very well and there are times that people are in crisis, and that the response that they get when they're in crisis and the assistance they get when in crisis can really help shape their recovery. So this is often the first time that police officers have interacted with a person in recovery, and we find that it's quite transformative, that they're really motivated to try to be helpful to these folks down the line. So that's included as a key part of the training. The training also includes verbal de-escalation skills for officers, which is basically teaching them how to use their words and use their body language to help calm down a situation rather than using physical force. And the training includes what we call role plays or scenario-based training that helps them practice those verbal de-escalation skills so that they get some real, sense of how to use it in the real world. And they use actors or volunteers to help sort of play out those scenarios, and they get feedback from the instructors and from their fellow students on what they did right and what they could have improved on. And then finally, the training includes information about how to connect a person in your local community with mental health services, and sort of covers the waterfront in terms of what's available in the middle of the night, on the weekends, what do we do with somebody in crisis versus somebody who maybe just needs homeless services or needs substance abuse services, tries to kind of get the police all the resources lined up that they might need to help a person. The training, the CIT training, doesn't typically include much time on intellectual and developmental disabilities, and I know that that's something that the folks at the National Center for Criminal Justice and Disability are working hard on sort of developing, so that that's something to think about down the line. And I don't know that it'll necessarily be integrated into CIT, but I think thinking of a similar kind of community partnership approach to CIT might be very successful for the IDD community. So CIT programs have been very successful in sort of achieving some of the things that they set out to do. First of all, one of the easiest things to measure has been the reduction in injuries during crisis situations, and that's usually injuries to officers because law enforcement agencies keep good records of officer-related injuries, and they're very concerned about them because of the time and expense that's lost when an officer is injured. There have also been fewer arrests of people with mental illness who are in crisis, and more connections to people to treatment when they need it. And finally, sort of less easy to measure, but really important, there's been a huge building of trust and engagement with the whole community around mental health crisis issues. And the founder of CIT, Sam Cochran, who is from Memphis and talks about, you know, how it transforms communities, always says that CIT is about changing hearts. It's not about training. It's not about police. It's about changing the hearts of a whole community. And it sounds a little bit schmaltzy, but it's actually true. It really does sort of transform the way that people think about mental illness, and it has a really profound effect on the people who are involved and on the whole community. And the training also, or the program also helps to satisfy the officers' needs for the right kind of skills and tools to do their job safely and effectively and in a timely way, which is really important because police officers, that's a huge priority for them. They have limited resources, and so giving them more tools is extremely helpful for them. Today, there are about 2,800 CIT programs in 47 states and the District of Columbia, and I don't have it on the map, but a handful of foreign countries. So the program is really spreading, and it's really taken off because it seemed to be so successful and because of the transformative effect that it's having on communities. So I'm going to transition now and talk about some of the lessons that we've learned in implementing CIT around the country and in working with law enforcement agencies, and some of the things that I think might be helpful to keep in mind as you are developing partnerships with your local police departments around intellectual and developmental disabilities. As I said at the beginning, not everything is going to be a one-to-one, you know, map onto the needs of your community, but I think that these are some valuable lessons that we've learned, and I wouldn't want you to have to reinvent the wheel in creating these kind of partnerships. So first of all, the thing that's absolutely most important about CIT, hands down, is the partnership and the commitment between mental health agencies, law enforcement agencies, and individuals and families to work together, to problem solve, to be proactive. The training is great, and everybody knows about the training, but the partnership is really what makes CIT something that transforms in the long term and makes it sustainable and successful over time. So I would really focus, I would recommend, and I always recommend this to the NAMI affiliates that I work with, focusing on building a really strong partnership and not getting worried as much about exactly what's going to be in the training, because the training and the sort of details will grow out of that partnership and that relationship. And just as an example of a good partnership I wanted to show, this is Herb Kotner, who's a police officer in Dallas, Texas, and I call it his partner in crime, Sherry Cusimano, who is the director of clinical development and community education at Green Oak Psychiatric Hospital in Dallas. So Sherry is a mental health provider, Herb is a police officer, and they both identify as family members of individuals with serious mental illness, and they teach together the NAMI family-to-family education course, and they also teach CIT together. And they came to me a couple of years ago and said, we really think it's important for families to know how to talk to police because everybody has a responsibility in the CIT sort of scenario to make sure that the best outcome is achieved. So we want to help to educate families. So they came to me and they said, we want to do this column on the website to provide the families some basic information about how to work with police. So I like this example because it shows how how we all have multiple identities, and how that can really help build the relationship and the partnership between agencies can be built on sort of the personal relationships and personal identities of individuals. And I think that that's been really powerful, not just for these two folks in Dallas, but all around the country. We find police officers who, say, I have a child with a mental illness, or I have a child with autism, or, my mother had schizophrenia, or I'm a mental health provider and a police officer. I'm a mental health provider, and I also am an individual living with a mental illness. So, there's just a lot of opportunity, I think, because unfortunately mental illness and developmental disabilities are so common. There is a way to reach people by sort of tapping into their personal experience. The next lesson that we learned that I think is really important to pass along is that it's important to get buy-in from your police leaders and also from your patrol officers who are working the streets and responding day to day. So when you're sort of pitching your partnership or your program or your training to the police, it's important to inform yourself about the police department and the challenges that they're facing. So I always say, find out how many square miles the agency is responsible for patrolling, how many officers they have, how big the population is that they're responsible for, how many calls they're responding to every month or every year. And that really just gives you kind of a baseline and an ability to speak intelligently with the chief or the sheriff about, your concerns, and that you understand that they're working hard and doing a lot of work, often with limited resources. Another thing to address with your police leaders is liability. I know for most police departments, using resources wisely and keeping the community's trust in them is really important, and so they want to, as much as possible, reduce the opportunity for there to be problems with liability, for them to be sued. We do not take an approach of, being aggressive or threatening, but we do want to make them aware that, that you can do a lot to reduce the risk and to reduce your liability, and part of that is training and engaging with these partner organizations. It's also important, and this sort of goes back to what I said before, to take into account the time and priorities of the officers and of the policing leaders that you work with. Often one of their biggest concerns is that police officers are spending a lot of time responding to mental health crisis calls for us, and they wind up transporting a person, 4 or 6 or 8 hours across county lines, maybe all the way across a state, to get them to a hospital or a center that will provide services for them. And then once they're there, they're sitting in the emergency room for, 4 or 6 or 8 hours waiting for the person to get evaluated. So it can be a huge use of their time. So you want to be pointing out how you will be helping them save time and focus on their priorities, which are community safety, officer safety, things like that. And then finally, we have sold CIT program as the CIT program as an officer safety program because it is it's proven to reduce injuries, and the use of verbal de-escalation does help to reduce the use of physical force, which benefits both the individual or the subject and the officer. So we really try to talk about that as an officer safety program. And it's a little bit of a culture shift, I think, for police to hear about officer safety is not, your weapons and your, your tactics, but it's about, the words that you use and the approach that you take. But it's a really powerful argument in working with law enforcement. the next thing I wanted to share was some of the lessons we learned about training and how to train law enforcement. And the first, and I didn't put this on the slide, but I should have, is that you should be working with your law enforcement officers in your local communities to figure out what their needs are and to address those specific needs, and also engaging them as trainers in whatever training that you do, so that they have so they have their input involved, and also so that the officers are learning from people that they recognize and trust, because that's going to be really important to them. With the CIT training, we usually try to keep things pretty simple, and I don't mean to water down or to sort of minimize, but instead of focusing on, for example, a diagnosis and all the symptoms that go along with it and all the medications, we focus on, and we do fill the officers in on those things, but we focus on behaviors and symptoms and how to respond to particular behaviors, and what symptoms might be a flag for a mental health condition, or if you see a certain medication in someone's medicine cabinet, that might indicate that they have a serious mental illness. We aren't asking officers to diagnose. We don't think that they're going to have time, and they don't. That's not really their role. So, but we are asking them to respond appropriately to behaviors that they encounter. It's really important to give officers a chance to build their skills and to give them a chance to practice. And it's really important to give them information on how to refer people for services, and sometimes that may require changing a policy or a procedure so that they know exactly where they're supposed to go and when, and who they can call for help if they need sort of assistance in figuring out where to take a person for services. And finally, and I talked about this before, but I think it's just really important, in the training it's really important to have personal interaction with a person with mental illness. It helps to demystify and destigmatize the condition, and helps the officers to see individuals as individuals in their community. So it can be extremely, extremely helpful in changing their perspective. And going along with that, I want to talk a little bit about a program that NAMI has called In Our Own Voice, which is a presentation that we have two individuals who live with serious mental illness talk about their illness and some of the different phases of it. So they'll talk about the really hard times. They might talk about a crisis they have, but then they'll talk about how they're moving toward recovery, how they got a good diagnosis, the things that they use to cope and to be successful, the things that they're hopeful about, or that they're, their ambitions, their goals. It provides sort of a good overview of, how a person could be in crisis today, but next week or next month they might be doing very well. So it's kind of gives a good perspective. And it's not just transformative for the officers to hear it, it's transformative for the individual to tell the story. And I hear this all the time. It's really powerful for the individuals to be able to tell their story without shame and to feel like it's having a huge impact on their community when they do this. And I include this quote from a NAMI member named Peyton from South Carolina, who has bipolar disorder, and he was in prison and for some actions that occurred when he was manic. And when he got out of prison, he got really hooked in with his local NAMI organization, and he got really interested in CIT. And one of the roles that he has now is as a CIT trainer, and he tells his story before police officers. And I just thought this was a really powerful quote, because he says that the biggest shame of my life has been my criminal record, and now I get to take my experiences and help save lives in my community. So an incredibly empowering thing for him, and also incredibly valuable for his community. Another thing that we learned from CIT that is sometimes a challenge to explain to people is that CIT seems to work best when it's a local program with sort of local ownership. And part of the reason for that is that every community is different, so you have different populations and different kinds of services that are available, and the law enforcement culture may be different. So you really want to have a program that's adapted to the, to the specific needs of your local community. Another reason why there has to be local kind of ownership is that, you know, law enforcement agencies, they want tools, they want training, they want, you know, anything that can make their jobs easier and that can help them serve the community better, but they still want control over what's exactly in the training and what kind of policies and procedures they have to change. So they're not really, you know, they don't want to be imposed on from a higher authority, which is fine. They, you know, they work independently, and they, you know, they want to be able to kind of meet their mission. So it's good to work with them to make it unique and make it fit their needs. And then, you know, the most powerful ways that we seem to be changing the culture is by connecting local law enforcement with their local service providers and with people with mental illness in their local communities. And one of the, you know, in a few places there have been attempts to mandate CIT training so that every, you know, department has to have it, or so that, you know, a certain state agency has to provide it to all departments. And I don't have any problem with creating training standards. I think that's absolutely important, that there should be more training on mental illness and other disabilities in the basic training for police. But mandating a training is not the same as mandating a partnership in our relationship, and that's something that you can't really mandate. You just have to develop and build. So, so we don't want that spirit of partnership to get left behind, even when we're implementing training. And as an example of local ownership, I just wanted to show you some of the pins that crisis intervention team officers wear on their uniforms. And this is something that surprisingly is like really important to the CIT community. Every agency has their own pin, and everyone's really proud of it. And at the CIT conference every year, there's a Best of Pin award that everyone votes on, and it's like almost as important as the CIT Program of the Year or the Officer of the Year award. So it's something, everybody has a pin, and that's something you see across the board, but it's always a little bit different, and they want to own it, and they want it to be theirs and to be special. That said, it's a local program, but there does need to be state and national support for that program, because it's a lot easier to do something like this if you have some tools and some resources and people who've been there before to help you guide through it. So that's one of the roles that I play in NAMI's national office, assisting our local and state organizations on this. Because they find that the most difficult part is often building this relationship, building this partnership, breaking down some of this mistrust or miscommunication. So I help problem solve through that, and we have state technical assistance centers in a lot of states that also really help with that and help to kind of build an infrastructure at the state level to support local programs. Another issue that's sometimes a challenge for CIT programs, and that it's good to have support from state and national resources, is around sustainability, and specifically around getting and maintaining data. It's been a challenge, because this is a cross-system collaboration, to get for a lot of communities to collect data. And you know, police departments often don't have you know, the expertise of an academic researcher on hand, for example, to help them design a good evaluation. So sometimes we recommend, you know, that's a good partner to bring on board, is to get a university or a research center to help you design the evaluation and the data collection that you want. And that's something that can be hard to assist from the national level, because each law enforcement agency collects data in a different way, and each hospital collects data in a different way, and so it's not easy to standardize. There's kind of nobody in charge. And then another thing that is helpful in having sort of state and national infrastructure is when there are changes in leadership. When your chief or your sheriff moves on and there's a new law enforcement leader, or when there's a new leader at your mental health agency, there's still this sort of culture of CIT, and there are still other agencies and neighboring agencies that are saying, you know, CIT is really important to kind of keep things sustained through that transition. So that's really been very helpful in a lot of states and communities. And finally, CIT programs love to help each other. So a lot of CIT programs will assist their neighbors, you know, in the next county or the next town over. And in a lot of states, it's helpful to have a statewide entity that helps to coordinate that and make that easier. So just as an example of why state assistance is so helpful, I wanted to show a contrast between CIT programs in Ohio and in New York. And I'm not trying to pick on New York here because I think New York is moving in a really positive direction, and there's, you know, going to be a lot more CIT programs in New York in the next few years. But right now, all the blue counties have at least one CIT program. And so you can see that in Ohio, pretty much every county except for one has at least one CIT program. And in New York, there's 3 counties that have a CIT program, and there have been other attempts to start programs, and they haven't flourished as well. And the difference between these 2 states is not that there's a mandate in Ohio or that there's a ton of more funding in Ohio. The difference is that Ohio has a statewide technical assistance center to coordinate and help all these local communities do their work better. And New York is fortunately is going to be starting a TA center next year. So I'm really hopeful about the direction they're moving in. But I think this just illustrates how important it is to have that support at the state level as well. And I think that NAMI organizations, NAMI I think is set up in a similar way to the ARC, that we have local affiliate organizations and we have state organizations and we have a national organization. So we're involved at all levels with our CIT programs. It's a little bit confusing because, you know, there's so many organizations involved, but we feel like it's important to have a local, a state, and a national presence. The next thing I want to talk about is one of the things we learned is that it's really important to support officers and to kind of be cheerleaders for CIT officers, because they do a really hard job. Interacting with people in crisis over and over again is really challenging. They do a really great job at it, and they're typically volunteers. They don't get, you know, extra pay, or if they do, it's very minimal. So we want to keep them engaged, we want to keep them motivated, we want to show them how grateful we are that they're doing a great job. So I always encourage my NAMI affiliates to say thank you during the graduation ceremony for the CIT program. A lot of affiliates will host an annual CIT awards banquet to honor the officers that are involved and to draw attention to the program, you know, to make sure that the leaders of the agencies know that the officers are doing a great job and that the community wants this program to stick around. Similarly, we try to get media attention for the training and for any positive outcomes that come from the training. So if there's an incident where an officer does something really great, we try to highlight that. And unfortunately, the media tend to like to tell the sort of bad stories and share, you know, when there's a tragedy. But we also want them to share the good stories, because I think that that's equally as important. We also encourage NAMI affiliates to write a letter of appreciation when they have a really good interaction with a CIT officer, and to send that letter to the officer's supervisor, so that the leadership in the law enforcement agency knows that this is something that's really valued by the community, that it's working, and we should continue to do it. And finally, NAMI affiliates serve as resources and partners for officers, for CIT officers, and for the CIT coordinators at the agency level. You know, they don't always know what's the right thing to do when they have a person in crisis who needs a particular kind of service at a particular time of day. So having somebody that they can call to say, you know, just to kind of talk it through with is really helpful. Or, excuse me. So we really encourage that, and that seems to happen very naturally as part of the relationships that they build at the local level. And then finally, we always encourage our NAMI affiliates to pay for lunch at the CIT training, so that the officers know, hey, NAMI is, not only are they, you know, a good partner and a good resource, but, you know, they're willing to help make sure that we're well fed and happy. And you can't overestimate how far that will go. Excuse me for just a sec. Okay. So the next lesson I wanted to mention is that it's really important that your partners think about how they're going to coordinate and plan the sort of process at the local level, like what do you do when there is a crisis situation, whose responsibility is it to do what. So we ask them to think about what are your intended outcomes and how are you going to measure them, and where are the challenges, where are the sort of difficult situations. So for the mental health community, the challenge is often that there aren't a lot of mental health services in a community. And another big challenge is that there's that people wind up in the ERs because there aren't these good services, and the ERs often feel really ill-equipped to provide the right kind of service to people in mental health crisis. And the officers get really frustrated because they are taking a person and then sitting in the ER with them for hours at a time, waiting for them to get services. And then the person is generally not very happy either because the ER is a really hectic and loud environment. It really is not calming or soothing. You know, and people, because the ER staff is often, you know, not well equipped to deal with this, people wind up being in restraints more than, you know, more than we would like to see. So, you know, and you can't always find a great solution in every community. You can't always find a different place than the ER, at least not initially, but what we encourage is better coordination. So for example, with the ER scenario, we try to encourage communities to create really clear guidelines of when an officer will take a person to the ER, so that the ER is reassured that, hey, we're getting a certain, you know, we're getting certain kinds of situations, and if a person is really dangerous, they won't be taken to the ER. And then the police are also reassured that they, you know, that the ER will be accepting the individual. And then we also encourage the creation of a you know, a sort of a handoff procedure that is smoother and faster. So, you know, officers share the right kind of information with the clinical staff so they have the information that they need. And that seems to help a lot to kind of move it along a lot faster, and everybody seems to benefit from that. So we try to look at those sticky situations and figure out how to solve that. And unfortunately, it's different in every community, so it is a bit of a challenge. And then in terms of planning and coordination, we also ask communities to think about who else needs to be involved, or other service providers need to be involved. Is there a huge problem with homelessness, and do we need to have homeless service providers involved? Do we have EMTs and firefighters frequently responding to mental health crisis calls, and do they need some training or some coordination? We always try to get law enforcement communications departments, the dispatchers who dispatch calls, trained in as well, because the officers can be, you know, wonderful at responding to calls, but the dispatchers are the ones that actually assign the officers to respond to specific calls. So the dispatchers need to know when a situation is a mental health crisis situation and not some other scenario. So it's really important to think about who else needs to be involved, what other partners do we need to bring in. And finally, do we need to change any policies or procedures, because sometimes the law enforcement agency or the hospital will have a procedure or a policy that is that contradicts the intent of the CIT program. So you have to kind of work through all that stuff together to be effective at having good change. And I'm choosing this quote from one of the leaders of CIT in Virginia to sort of illustrate that challenge. Victoria Cochran is the Deputy Secretary for Public Safety in the state of Virginia, but she was an advocate in the New River Valley area and helped to start the first CIT program in Virginia about 10 or 12 years ago. And one of the things that she emphasized was how important it was for there to be a central assessment site for officers to take an individual to drop them off to get an assessment that's adequate. So she said, without an assessment site, it's more like they're walking into a blind alley with nowhere to go. With the assessment site, law enforcement can see where they're going and everyone can get there more safely. So not every community has an assessment site, but the idea is, like, we at least need to know what the path is and what the plan is, and that makes everyone feel a little more secure in what they're doing. So that's been really important for all of our CIT programs to have a plan and to have a long-term vision. Like, if our community doesn't have adequate services today, that may not be something we can fix today or this month or this year, but it is in our long-term plan to advocate for the right kinds of services and the right kinds of places. So you have to know where you're going. You have to know where your vision is. And then finally, whoops, I skipped one. Finally, with the CIT program, there's a really important role for advocates, and I think that this is something that is going to be very similar for the intellectual and developmental disability community. That our NAMI affiliates play the role of bringing partners together in a local community. They're often the ones that sort of convene and invite and cajole and convince people to talk to each other, which is the very first step and the most important. We also serve the role of promoting and spreading the program around the country. So a lot of CIT programs heard about CIT from the NAMI convention or from other NAMI affiliate organizations around the country. And I think it's really important to promote something that's good and to kind of keep pushing for that. Then another role for advocates is obviously to make sure that the program stays true to its intentions and to its purposes. So there is the voice of individuals with mental illness or individuals with developmental and intellectual disabilities in the training and in the decision-making, and their family's voice as well. So we're really meeting the needs of the people that we are trying to help and to better serve. So that creates a sense of accountability and a mutual accountability between the partner agencies. So, no one agency is in charge and making all the decisions. Everybody's working together. So we're all expecting things from each other. And that seems to work really well for CIT programs, especially when the local NAMI is really active and keeping that partnership alive. And I talked a little about the cheerleader role, the role of supporting officers. And finally, the last role that we've played and that advocates around the country started to play is educating families and individuals about how to interact with police, because we recognize that if everybody's working together and doing the very best that they can, the outcomes of these situations will improve. And it's not to say that, anyone's to blame more than another, but that we're not really talking about blame. What we're talking about is how much can we all do together to improve the outcome of a situation that might have been tragic. So that's what the Ask the Cop column that I referred to earlier is about. How do we make sure that families know what to say when they call 911, or that individuals know that there's a CIT program out there and they see that CIT pin and they know that they can trust that officer. So it's all about kind of outreach and education. So I hope that some of these lessons are valuable for you as you think about how you want to partner with your police department in your local community or in your state. And I know, as I said in the beginning, I know that the needs of our two communities aren't exactly, going to map on one-to-one to each other, but I hope that some of these things have been helpful to you. So that is the conclusion of my presentation, and I am happy to answer questions, and hopefully Catherine will jump back on here to assist as well.
Yes, Laura, thank you so much for a wonderful presentation. I'm going to start now with some Q&A. So if anybody has questions, you can submit them in the chat box or in the Q&A box. And if we don't get to them during the webinar portion, then we'll follow up with you by email. So also don't forget we have a short survey for you to fill out after the webinar. So on to the first question. This is from Jessica, and she says, I work in a state that has mandatory domestic violence arrests. These laws control and in some cases clash with part of the CIT training with regard to teaching officers discretion on whether or not to charge on low-level offenses, for instance, adult threatening or acting disorderly toward their parents. Do you know how other states have dealt with this, and do you have a CIT legal contact?
So that may be something I have to follow up with afterwards, but I mean, you have to keep in mind that the officers have to follow the law, so you can't ask them to do something that's, illegal in their state. But as you said, it may be sort of a policy or a legal issue to address. I will try to find somebody that has a comparable situation and get back to you. If Catherine can take note of who asked that question.
Absolutely, I'll put you in touch. And we did have a quick in the Q&A. Yes, the webinar will be available after the fact. As soon as we can get it posted, both the PowerPoint and a recording of this session will be available on our website, and I'll send all of you an email when that's up and posted. All right, back to substantive questions. Do CIT programs include partners outside of mental health and law enforcement, like victim service providers or attorneys or other professionals?
Absolutely. It varies from community to community. What we say is when you're starting your program, you want to make sure you have your advocates, your law enforcement agency, and your mental health provider agency. That's like the foundation. But a lot of programs grow. They include other criminal justice professionals. They include other service providers. They include other advocacy communities or disability communities. It's all, like I said, it varies a lot from community to community. What we've seen a lot of growth in veteran service organizations and veteran service providers being involved in CIT, homeless services, substance abuse services, children's services in schools. So it kind of has branched off in a lot of different directions depending on the community.
Great, thanks. Here is the next one. Is all CIT training exactly the same? Is it standardized in any way? And if not, are you moving in that direction?
Okay, so right now it is not all exactly the same around the country. There are guidelines for how many hours the training is and what topics are included, but there's not a certification process, a national certification process to sort of enforce that. There is, the Department of Justice is developing a CIT training that will be a more fully completed curriculum. It won't be, at this point, I don't think it's going to be the standard or the mandatory training. It's going to be an option or a tool. And I think it's a little bit of a tension because, like I said, law enforcement agencies and communities really want a tool that they can use right now, that they can kind of, you know, pull off the shelf and it's going to work for them, you know, it's going to work and be effective. And that's great. We want to give them as many tools as possible. But every community is a little bit different. So, you know, New York City is going to have really different needs from small town New England. And different, you know, there are different multicultural communities in language needs and disability needs and homeless problems and, you know, various needs in different communities. So we don't want to make things too cookie cutter without having some room for adaptation. I hope that answered the question.
Yeah, no, that was great. And it actually goes right into our next question from Stephanie. What suggestions do you have for developing CIT in rural areas? Are there any actual models that rural areas use as a guide? Because she said she's found information on limitations, but not a lot of information on how to overcome that.
Right. So it depends on what you mean by rural. There are rural communities, and then there are frontier communities that are really much more remote. But there are a lot of rural communities that have done multi-jurisdiction programs. So they'll get, you know, they may be even multi-county programs. So they'll all kind of band together. They'll have the one training that they all work together on, and they'll coordinate, and it's actually pretty cool, they'll coordinate services across counties, because in a lot of communities, in a lot of states, you know, your nearest mental health center or your nearest psychiatric hospital may not be in your county. It may be 2 counties over. So having that coordination is actually really helpful. But it is a challenge. It can be challenging for rural communities, and especially for law enforcement agencies because they have so few officers, and taking them off of their shifts for a full week to do training can be challenging. So what we suggest is if you have a multi-jurisdictional program, then, you know, maybe your agency only sends 1 officer at a time instead of trying to send everybody. So you build up to having, you know, everyone trained over the course of months or years, usually years, depending on, you know, the size of your community. I can excuse me, I can provide some more detail on that as well and follow up afterwards.
Great. And it looks like we've just reached the 2:30 mark. So, Laura, you're off the hook on more questions. I would like everybody to sign up to receive email alerts if you're interested, and use our NCCJD's information and referral service. So if you know of an issue where somebody has a disability and is involved in the criminal justice system, please reach out to us. If they have mental illness, we often collaborate with Laura here to make sure they're finding what they need. So thank you, everyone, for attending today. That concludes our program, and if we didn't get to your question, we'll be sure to follow up afterwards. See you all next time.
Thank you, Catherine. And if you ever need to reach out to me, you all are welcome to email me or to visit our website at NAMI.org.
Great. Thanks, Laura.
Thank you.